There's a growing number of medical experts say that people should be wearing masks indoors again to help ease pressure on the NHS. Hospitals and GP surgeries are already asking patients and visitors to wear masks as public health officials warned that we're approaching a twindemic of high COVID and flu cases. Dr. Satpal Shekhawat from Curtin in Lindsay says it's a good move and more can be done. We'll be hearing from him in just a moment. But first, our health correspondent Anne-Marie Tasker is here. How bad is this flu season?
Well, Peter, in England, the number of flu cases has gone up or stayed high every week since mid-October. Over the festive break, there were more than 3,700 patients a day in hospital with the virus. That compares to 34 a day that time the previous year. Today, in East Yorkshire and Lincolnshire, there are 228 patients in hospital with flu, 119 with COVID. And while hospitals are already dealing with record demand for emergency care and hundreds of patients who can't get the care packages they need to go home, they say masks will reduce the impact of flu and COVID.
If we had a rise in the number of flu cases and COVID cases, it would make our bed capacity even more stretched than what it is. Not only that, if you have either flu or COVID in patients who are recovering from operations or recovering from another illness they got admitted with, it would delay their discharge and also have a negative impact on their recovery.
At the height of the pandemic, masks were everywhere, on buses, in shops, on the street. Today, seeing someone wearing one out and about is a rarity. But with high numbers of people with respiratory illnesses, some are taking no chances.
I'm paranoid about catching anything. There's the two viruses going together, the COVID and the flu, yeah? So I don't want to, be caught napping.
Why take the risk? I mean, we still see the odd person wearing masks. And it's like for health reasons, really. I mean, you don't want to take something home and give it to your elderly mother.
I've got other illnesses, I'm elderly, so I don't want to pick up any more bug. I've already had the COVID and I don't want it again.
And amid the high levels of flu and COVID and the pressure that's putting on the NHS, public health officials say going back to the pandemic's message of hands, face and space will help stop the spread.
There is a really strong evidence base now that if people are wearing face coverings, it will reduce your risk of catching the disease. If you've had all your vaccines, that's going to reduce your risk of catching the disease. If you keep 2 meters plus from people, that's going to reduce your risk of catching the diseases.
And although they say bringing back masks in healthcare settings will make a difference, getting people who haven't yet been vaccinated against COVID and flu to have their jabs is vital. Anne-Marie Tasker, BBC Look North.
Well, Dr. Satpal Shekhawat is a GP in North Lincolnshire, and I spoke to him a short time ago. Doctor, I gather you're very busy at the moment. Are you seeing higher levels of flu and COVID at the moment?
Yeah, we're seeing quite a lot of upper respiratory infection cases, Peter. So there's a large increase in patients with coughs, colds. Some of them have got flu, some have got COVID, some have got bacterial infections as well. But it's putting pressure on the system.
So, quite simply, should people be wearing masks again in doctors' surgeries and hospitals, yes or no?
Absolutely. So in our practice, we are promoting and requesting patients to wear masks when they're coming in, purely because in small enclosed spaces, especially if you're coughing, there's high risk of transmitting infections.
Would wearing a mask in somewhere like a supermarket be a good idea? Because no one is wearing them at the moment and many people would feel very uncomfortable. In fact, people are already writing to me today saying face masks, absolutely no. We've been there. We're not going there again.
I think if we think logically and we look back at the lessons we learned in 2020 or 2021, in winter months, we had less seasonal infections. We had less cough, less chest infections. That was because we were washing our hands more properly. We were spending more time wearing masks. We were ventilating our rooms and households better. We were wearing masks in crowded places. So doing that would benefit. We know it works and it is inconvenient, but it will help us
You say you know it works. I mean, several people have written to me this afternoon saying, you know, there's no proof that masks do help. Are you telling me they do?
Well, they have, and we know that even in the pandemic, when we were wearing masks, there was a drop in reduction of chest infections. People who have underlying health conditions, they were having less chest infections, less hospital admissions. So from diseases which spread by droplets, if we are containing them by wearing masks, they will reduce the risk of spreading it to others. So clearly it does work. Science, public health have found that it works. It's inconvenient. I can understand why people are reluctant. But when we've got massive increase in number of infections, wearing masks is a good thing.
Be very keen to get people's views on this tonight. Dr. Satpal, very good to have you on the programme. Thank you very much indeed.
Thank you.
Yeah, people get very exercised on this one. And I mentioned there people, you know, sort of having a go and being sceptical. This in just a short time ago. Disappointed to see the BBC highlighting the so-called benefits of face masks once again. We're supposed to be following the science, but there is plenty of scientific evidence out there that states that they are largely ineffective. But you've just heard there from the doctor how they work. Well, I'd like your views on this. You do need to wear masks again when you go into hospitals or your GP surgery. Cases of flu have been steadily increasing in recent weeks, up 47% hospital cases last week. Is this the right move? Do you welcome it? Maybe you wear a mask as a matter of course anyway. Just a few people still do. Let me know what you think about this one. The usual ways. Just a reminder, the email address looknorth@bbc.co.uk, all one word, look north. Text 81333. Start that text message with the word look north, then it comes straight to us or goes nowhere else. Or follow me on Twitter and tweet me now. I'll get it straight away here in front of me in the studio. Look forward to hearing from you. A man from